Facility, which is a partnership between PAHO, utilizing the PAHO revolving fund, which is normally used for immunizations and other things, and also with CARPA involved as well. And what that does for us is to guarantee us, in the first instance, about 20% vaccines, or vaccines for 20% of the population. So that's between 50 and 60,000 people in the first instance. So as soon as the vaccines are available to the facility, then that process will commence. But what you need to understand is that most or all of the information which has been put out on these vaccines really have been put to the media, and no information as yet has gone to the centers like CDC in the United States, WHO and so forth, so that they can validate and to check the science and everything. So that process has to be done. And once we get the vaccines, then we will start to roll out our program here in Barbados.
Any thought given to the selection process in terms of how those initial people will be?
A lot of thought has to be given about that, but that is part of the process at the moment. And that even if that decision or that recommendation was made by health, it still has to go up the chain, because this is something that is bigger than health, because there are other national security imperatives that have to be considered. So that the decisions will be made at the highest level, which including cabinet, but we will make the recommendations from a health perspective. And when that information can be communicated, it will be communicated to the press. But at this point in time, there's no definitive response, because we are in the process of planning everything in relation to the vaccine.
Thanks, Dr.
You're welcome.
Are you concerned that there might be an anti-vaccine movement, because people are sometimes...
Yes, no, absolutely. We've seen some evidence with that in terms of our immunization program, although we're still at a very high percent, probably about 84% at this point in time. It used to be in the 90s. It's a growing movement, the anti-vaccine movement worldwide, and we anticipate that there will be some issues there as well. But we are part of the plan going forward is to mount a very massive public relations campaign to give Barbadians the assurance that there's nothing wrong with taking the vaccine when it is available, and that given our immunization program over the years and the success of that program, that Barbadians should feel confident in taking the vaccine. And we will be monitoring this very carefully, and I can tell you up front, before you even ask me, as a soldier I lead by example, so I will take the vaccine, and I'll do that publicly.